Polycystic ovarian syndrome, also known as PCOS, is a very common endocrinological problem which is seen in women of the reproductive age group. It is a heterogeneous disorder which is mainly characterized by menstrual irregularity, facial hairing, acne, and along with that polycystic bulky ovaries. The exact cause of polycystic ovarian syndrome is not known, but it can run in families. It is generally associated with excess production of androgen from the ovaries, which eventually leads to anovulation and insulin resistance. In India, around 20 to 25% of the women of the reproductive age group suffer from polycystic ovarian syndrome. 1 in every 10 women in India have PCOS, and out of every 10 women with PCOS, around 6 are teenage girls. So, what are the common symptoms of PCOS? The most common symptom is menstrual irregularity. So, period duration ranging from around 2 to 6 months is seen in patients with PCOS as against the normal duration of 30 days. Also, sometimes the patient may totally miss the period and they might need medication to induce the menses. The bleeding in PCOS can be heavy with prolonged flow, or sometimes it can be scanty with reduced flow. Along with this, the other symptoms include acne, generally on the face, and facial and body hairing. Along with that, it is associated with loss of scalp hairs. All these symptoms are generally due to the excess androgen production. Bulky and polycystic ovaries are seen on a transvaginal ultrasound, along with small cysts which are present in the ovaries. So the diagnosis of PCOS is generally made on clinical presentation. And on vaginal ultrasound, we can see bulky enlarged ovaries with multiple polycysts which are present in the ovaries. Also, certain blood tests are generally done to rule out diabetes mellitus with fasting and post-meal blood sugar levels. PCOS is sometimes associated with other metabolic disorders like obesity, hypertension, diabetes mellitus, increased lipid profiles, increased risk of endometrial carcinoma, sleep disorders, sleep deprivation, depression, anxiety issues. Treatment in PCOS cannot be completely cured, but the symptoms can be managed. So the treatment in PCOS is mainly in the form of lifestyle modifications. In lifestyle modification, it is generally regular moderate type of exercise and weight loss. Even 5% reduction in the weight can result in complete relief of the symptoms. Following a healthy diet in the form of high fibers and high protein along with reduction in the carbohydrates is generally recommended. Avoiding smoking is also advised, as increased amount of smoke results in increased androgen levels, which can again precipitate PCOS. Other than this, the main drugs which can be used in patients with PCOS generally include oral contraceptive pills. Oral contraceptive pills help to regularize the cycles, and they also address the problem of acne and facial hairing. For the women who desire fertility, it is generally ovulation induction which is the main form of treatment. Along with this, certain medications like metformin is generally used to reduce the insulin resistance. It also helps to reduce body weight. So PCOS is basically an emerging syndrome of the adolescent age group, which can be controlled with lifestyle modifications. Along with that, early diagnosis and early intervention can eventually prevent the long-term complications of PCOS.